Hi mums. This exercise is called Kegel Breathing, and it's a really nice way of coordinating the breath with the pelvic floor and getting that deep core, the abdominal wall involved as well. So first we need to make sure we've got our beautiful breathing pattern going correctly. So you can place your hands on your rib cage, take a deep breath in, and you should be able to feel and potentially see the expansion of the rib cage. And we want it not just out side to side, but a little bit front and back as well. So the entire rib cage is expanding out with that bucket handle movement of the ribs. Sometimes we teach more belly breathing in order to get the pelvic floor working as effectively and getting that deep breath in. This rib expansion is going to be the most helpful way to support you through your pregnancy. But I can appreciate it's difficult if your ribs are already feeling really full and flared in your later pregnancy. But give it another go. Inhale to feel the ribs expand. Exhale to feel them soften and come back in. Now, the pelvic floor works with the diaphragm. So as you breathe in, your diaphragm is moving. As you inhale, the diaphragm lowers down because the lungs fill with air and the diaphragm kind of flattens out. As you exhale, the diaphragm is going to float back up as the air leaves the lungs and there's less pressure down on it. The pelvic floor moves the same way with the diaphragm, and that helps to maintain just a constant pressure in this abdominal space. So as you breathe, the inhale is going to lower the diaphragm. The pelvic floor lowers down and relaxes during the inhale more easily. And then as you exhale, the air comes out, the diaphragm lifts, the pelvic floor is already floating back up. So if we were trying to combine the pelvic floor activation or do a Kegel with the breath, you're generally better off doing it with the exhale because it's already moving in that direction. So try a few here. As you inhale, pelvic floor is relaxing. As you exhale, pelvic floor can engage and lift as the air leaves the lungs. And we're doing that active Kegel on the exhale. This can be really helpful in day-to-day activities as well. So as you are lifting up a basket of laundry, bags of groceries, children, if you can think breathing out to engage the pelvic floor, decrease that pressure down through the tummy, it means your pelvic floor is more supported. So less downward pressure in terms of prolapse, less bladder pressure, which might contribute to leaking. And also you've just got that more active support around your pelvis and your back to help with any pelvic or back pain as well. So remembering that the Kegel breath, inhale, relax, exhale to engage. Give that a try and let me know what you think. You can leave any questions or comments down below.